Hello, my name is Peggy O'Neill, and I'm going to do a practice example of how you would insert a Foley catheter. The first thing that I would do was I would enter in the patient's room and I would identify myself. I will let them know that my name is Peggy O'Neill. I'm your student nurse for today. I will let them know that the doctor has ordered for them to receive a Foley catheter, and I will ask the patient, are they okay with it, and hoping that they would say yes. The second thing I would do would wash my hands, provide privacy. I will identify the patient by asking the name and asking their date of birth to make sure that I have the right patient and let them know that the orders are correct. The second thing I would do is I would don gloves. It would be just clean gloves because this part of is just clean procedure. Next, I will assist my patient in getting into the dorsal recumbent position, rolling the cover back. I would assist my patient by asking them to spread their legs and bending at the knee. Next, I will begin opening my catheter tray. Okay. I'll open away from me. Open the sides close to me. The 1 inch margin is what's sterile. Then I will get my gloves. I'm starting my sterile procedure. Putting gloves on the dominant hand. Putting gloves on the non-dominant hand. I will turn my sterile field so that it can be close to me. I'll turn this way. Okay. Shiny side goes face down in between my patient's leg. Move everything that's unnecessary out of the way and only use the items that I'm going to need. I'm going to open up my iodine swab sticks. I'm going to open up my lubricant, put it in the corner. I'm going to go ahead on, take the plastic off the catheter. I'm going to be very careful so that my catheter will still remain sterile. I'll put my catheter into the lube. I will go ahead and get my sterile water ready in place, because once my left hand touched the labia, it will not be sterile anymore. So I have that ready. Okay. I'm gonna move closer. Okay. Get to the labia, clean farthest away from me, top to bottom, go around, clean closer to me, top to bottom, come out, go around, clean down the middle, straight down, come out, go around. Now that my hand is on the labia, this hand is considered non-sterile. I will get the catheter. Place inside the lube. I'll begin to insert. Okay. Now that I see urine, I'm going to insert 1 more inch. Okay. After I see urine, 1 more inch. Okay. I pull back. Catheter's in place. Normal saline. Insert 5 milliliters. Okay. Okay. Now that the catheter is in place, I can take off my glove. I'll put on clean gloves. This part of the procedure is not sterile anymore. I will get the catheter bag. Use the stay lock to lock on the patient's leg. I will get the catheter and lock it on the bed, not on the bed rail, and I will place the catheter bag below the patient's waist. And this is how you insert a Foley catheter. Okay. Now, if I was removing the Foley catheter, what I would do, I would enter back in the patient's room. I would identify myself and let them know, hello, I'm Peggy O'Neill. I'm your student nurse today. And also, I would have also asked, before I got started with this procedure, I would have asked my patient if they're allergic to any latex, iodine, or shellfish. Okay. So when I get ready to remove the Foley catheter, I will enter in the patient's room, identify myself, let them know I'm Peggy O'Neill, I'm a student nurse, and let them know the doctor has ordered for the Foley catheter to be removed. I'll ask the patient what's the patient's name and let them tell me their name, their date of birth, to make sure that I have the right patient matching with the right doctor's order. Then I'll get started moving the catheter. Okay. I have a syringe. The same amount of water that I put in, I remove back out 5 milliliters. I'll unhook the stay locked from the patient's leg, and I'll hook the Foley catheter from the bed. I'll ask the patient to take a deep breath. And I'll wrap the catheter around my finger as I take it out. I'll look at the patient to make sure I don't see any rash. I don't see any bumps. I don't see any bruises. And I'll look at the catheter tip to make sure that the catheter is intact. Okay. I will take the catheter. I will empty the urine out. Okay. I will document the color of the urine. I will document if there is any odor. I will document the amount of urine, and I will also document the time that the Foley was taken out, my initials, and I will also document the patient's tolerance to this procedure. Thank you.